A popular beauty treatment is now being used to treat TMJ. Our sponsor, Dr. Stan Farrell, diplomat of orofacial pain, is here to tell us how this works. How are you this morning?
Good, thanks. How are you?
I'm great.
Great.
Let's talk about TMJ, because we were just talking to someone, he goes, what is TMJ? There's probably a lot of people that don't know what it is.
Yeah, I mean, basically what it is a lot of people, either clench during the day or night, usually at night, and they grind their teeth, and then it tears up the joints, and they get lots of muscle pain and headaches as a result of that. So with that, you get a lot of muscle spasms and just a lot of problems. People suffer from it. And for many years, it was thought that there's no cure for it, you got to put up with it. So a lot of people are walking around with jaw pain and headaches, and they just kind of put up with it because they think, there's nothing they can do.
Right.
Yeah.
And I know a lot of people probably go to the dentist. They think it's something with their teeth or something.
Right, yeah.
If you have any of those symptoms, listen up, because this is probably what it is. All right, so TMJ, and now they're saying that there's actually a beauty treatment that can help it, Botox?
Well, it's not, it's the same thing that's being used for beauty, but we're using it for pain control.
Okay.
And what we're really doing is we're making it so that these muscles that are spasmed and causing a lot of clenching problems aren't doing that. So we really calm the muscles down, and that's the trick. And when you do that, you don't have the pain, you're not tearing up the joints as much, and you're having a lot less headaches if you suffer from headaches.
Now, how often would you have to get the Botox injected to make it feel better?
Yeah, it typically lasts 3 to 4 months. So for the typical person that's having discomfort or having these problems or can't control how much they're biting or clenching, they get 3 to 4 months of relief. The nice thing about that is it kind of subconsciously or neurologically creates a sort of memory so that when it wears off, you're not as bad.
Oh, good.
Yeah.
Now, what is the process if someone comes in? I mean, are they going to just be put through the ringer trying to figure it out, or is it a pretty easy process to figure out if you have TMJ?
Yeah, we use a very detailed set of exams. We check neurologically, muscular, and also skeletally in the joints. And then we determine what the problem is and actually treat the problem as opposed to just fix your bite or this and that. And most of what we do is medical. As opposed to dental.
Okay. Yeah. Insurance, that's huge. A lot of people don't want to come in without insurance. You guys take insurance?
We do. We take medical insurance and also Medicare as well.
Okay.
Yeah.
Great. Well, I know we were just talking a few minutes ago. I go, I think I have it. You're like, I think you do too.
Oh, yeah.
Because it's as easy as just feeling a pop, right?
Yeah. Oh, yeah.
Now, can children get it too? Because my little guy, he clenches all the time, and he's only 4.
Oh, yeah. No,
he can't be that stressed out.
It is common. Yeah. A lot of kids do get it. We typically won't use Botox on kids.
Right, that's probably a good thing.
Yeah, that's merely something we're going to do, for adults if indicated. But with kids, a lot of the times it's because they can't breathe.
Right.
The tonsils or the adenoids, and then they grind and clench their teeth is a way to try to open their airway.
Okay.
So that's actually pretty common.
Great.
Yeah.
Great to know. All right. Well, if you have any of these problems or you think you might have something going on with your jaw, this is the man. Call AZ Headache, AZ TMJ at 480-945-3629, azheadache.com or aztmj.com.